First off, welcome. Hopefully you all know by now today's topic is on health disparities. And with that, we have our lovely Shantara that is going to be doing our training today. So I'm going to go ahead and hand it over to her.
Good afternoon. I'm Shantara Glasgow Scott. I'll be doing your health disparities overview today. Today, what we're going to be looking at is understanding health disparities and their cause. We're going to be looking at building competency of alleviation strategies within our organizations. And then we're also going to be looking to provide some additional tools for further education, things that you guys can look at on your own time and go more in depth with. So I wanted to do a bit of a background check and just get a look into what you guys have at the current moment as far as knowledge on health disparities. If you could go ahead and tell me your experience in the area of health disparities, we would like to know that. Okay, wonderful. Well, let's go ahead and move forward. So, overall, we want to know, what are health disparities overall? So they are the prominent differences in health outcomes and their causes among groups of people. So they're closely linked to social, economic, and environmental disadvantage. And these disparities, they really adversely affect groups of people who systematically experience greater obstacles to health. And this can be based on their race or ethnic group, religion, socioeconomic status, gender, age, mental health, any cognitive, sensory, or physical disabilities, their sexual orientation or gender identity, their geographic location, and other characteristics that are historically linked to discrimination or inclusion. So it's a real issue. And sorry, I'm having some clicking issues here. So bear with me. So since 2011, the CDC has published the Health Disparities and Equalities Report, and this is done in an effort to identify current health disparities across the nation. And their last report was published in 2013. After they published their 2013 report, they started to publish toolkits to help address these disparities. So just to get a little bit more in depth in what disparities look like, I wanted to bring some of the information that the CDC found to light here, just to give some examples. So one example is the rate of premature death, which is death before the age of 75 from stroke or coronary heart disease, was higher among non-Hispanics, Black, than whites. The infant mortality rate for non-Hispanic Black women was more than double that the rate was higher, twice as high for Black women than it was for Hispanic white women. And the infant mortality rate of a country is normally seen as a major measure of health across the country. So the fact that we have this major disparity that exists in infant mortality is a huge issue as well. Another disparity is preventable hospitalization rates were higher for residents of lower income neighborhood compared to higher income neighborhoods. And another major one that I found was diabetes prevalence was highest among individuals with a disability compared to non-disabled counterparts. So as you can see, disparities can exist within any group within the U.S., and these disparities vary greatly. But one thing that they all have in common is that they adversely really affect the group that is experiencing that disparity. And a lot of people like to think that it's personal choices that create this, but what health disparities looks at is the real reason behind why that disparity exists. So what is the importance? Why do we even care? So the alleviation of health disparities is really important because these disparities don't only affect the individuals who are experiencing them in society. It affects in the entire society as a whole. So we really want to alleviate health disparities because we want to see a positive health growth as a nation. We want to bridge the gap between the indicators of the privileged and the disadvantaged. There shouldn't be these huge gaps there. We also want to build health equity and social capital within marginalized communities across the nation as a part of making our communities and our nation stronger. We want to reduce the occurrence of morbidity and mortality as a result of preventable barriers within marginalized populations, while also reducing the heavy monetary burden on the U.S. healthcare system. Health disparities does affect our country financially. So when I think about health disparities, I think about what causes them, and what causes them are what's called the social determinants of health. These different areas are all combined together to basically create what are known as our health outcomes. So of these social determinants of health, they look at environment, socioeconomic status, education, food, community, and the healthcare system. Health status is not solely determined by personal behaviors. And that's one thing that we have to understand. It is not solely determined, and we won't advance as a country by only utilizing health behavior interventions. So a lot of individuals are born into and live with several of these societal pressures, which ultimately affect their health outcomes. So all of these together create our health outcomes. Moving forward, I found this great visual just to get a little bit more in depth from the Institute for Clinical Systems Improvement. And it really shows how half of our health status is traced back to our zip code, what kind of education exists, the job statuses, the family support, income, community safety, and furthermore, the physical environment, which makes up a full 10%. Now, as I said before, health status is not solely determined by personal behavior, but as you can see here, it is in part determined by health behaviors, 30% to be exact, and then also 20% by health care. So going a little bit more in depth in each of the different social determinants of health, we have socioeconomic status. This is the income level of the individual or the individual's family overall. And a lot of the times, this is not just present time, it can be historical socioeconomic status of that individual and their families. If they have been in cyclical poverty, this definitely plays a role. So this is the income and steady employment. It goes into their expenses and their debt, their medical expenses overall, and then the household support in general. Next, we have the environment, and I think this is a huge issue. So stable housing, if an individual doesn't have its primary needs being met, how can they focus on secondary needs? So stable housing, those who are homeless or have housing insecurity often have lower rates of, often have worse health indicators. Transportation, how am I getting to and from these places that are supposed to provide me support in my health? Geography, a lot of places that are rural have issues with their health status because of simply where they're located in the world. And then safety is a huge part. How can I go out and let my children play or go to parks? And how can I go bike riding in my city when it's not safe? I have a fear of violence. I have a fear of racism. All of these things are a part of environment. Moving forward, we'll look at education. This is higher education, those who, have post-secondary education degrees. Vocational training is their job training in the area. Has it been utilized? Literacy levels, what school level of completion do individuals in the community have? And then language barriers. We see this a lot with our immigrant population. There's a lot of language barriers that may exist that prevent them from adequately sharing what their needs are, and adequately sharing what symptoms they're experiencing or what hardships they're experiencing. Food is a huge issue. Food insecurity, even though a lot of people oftentimes can receive subsidies from the government, like SNAP assistance, or some people call it food stamps, there is still an insecurity there because there is a capped amount each month that they have to spend. And normally with that, they have to choose the cheapest food sources, which aren't always of the best quality. There's also the variety of choice. Are there healthy produce available in the area? And then grocery store proximity. A lot of the times, many people in rural as well as urban areas deal with food deserts, which are areas that have very few grocery stores, full-size grocery stores where they can pick up a full range of groceries and produce. And these issues create poor eating habits. They create issues of food insecurity in general. Next is community and social context. So support systems, overall stress, community engagement, and discrimination. When you let's say deal with gentrification, a lot of the times different individuals from other cultures may move into your neighborhood and the neighborhood may change. This fear of discrimination from that change in environment can really cause a lot of stress. It can cause one to become withdrawn from the community. On the other hand, if the community is unsafe and it's impoverished, that community engagement may not exist simply because it is unsafe. So all of these different things make up community and social context. Then we get to the big kahuna, the healthcare systems. So this looks at the provider availability, the quality of care, health coverage, and then the linguistic and cultural competency. There are different cultures who have a mistrust of the healthcare system and of healthcare providers in general. And there are many healthcare providers who are not aware of this cultural thing. They're just not cognizant of it. There's also individuals who study medicine who are not aware of social norms from different communities. And as a result, it creates a barrier. It creates a trust barrier, and it creates a understanding barrier. While there are a lot of people who are now covered under health, who now have health coverage through the marketplace and the Affordable Care Act, that's always in jeopardy. So health coverage is still one of those big issues. A major thing that I look at is also quality of care. If there is a provider who is caring for a substantial number of clients versus their counterpart in another part or wealthier part of town, that quality of care can be reduced simply because they have far too many patients on their plates. I see this all the time in emergency rooms as well as health clinics. And then provider availability. If there are only certain providers in your area that accept your health insurance, you are confined to using that provider. And sometimes if you need a physical or if you're having having any major health complications and you need an appointment, it can take weeks to months to get an actual appointment on the books with your provider. And this creates yet another barrier. So here's some food for thought. I wanted to have just a little bit of conversation. I know all of our clients are tackling different issues across their programs, but I wanted to know, think about what social determinants of health, if any, your organization aims to improve. And then I want you to think about what social determinants of health does your organization have the capacity to impact, but may not be pursuing. So combating disparities, I think advocacy is extremely important. So I know a lot of grants that are written and a lot of the work that you're geared towards, it is very cut and dry. You are limited in what you can do. But advocacy is always action that can be taken no matter what type of grant you receive. So advocating to have services intended to build health equity added to program funding is extremely important. And we're going to talk about some health equity next. So health equity is the idea that all members of society have the opportunity to achieve positive health outcomes and receive quality health care tailored to their needs, regardless of where they live, what they have, and who they are. This is really important, because health equity is the answer to addressing health disparities. The more health equity that we have across communities, the less disparities we're going to see. See, health equity is often equality is often mistaken for equity. These are not the same. Equality refers to treating everyone the same regardless of specific needs. And this does not mean everyone has the same opportunities. Equity considers the different barriers that exist for each community members. This promotes the understanding that some need additional supports to reach optimal health. And that's what we're seeing here in our visual. Ensuring individuals have their basic needs met is the first step in improving their health outcomes. A universal approach makes the assumption that everyone has their basic needs met, and that is not always the case at all. So here in the left side of the photo, this is equality. Everyone is given the same boost, although they are at different levels in life. That is an issue. It does not take into account their individual needs. Equity, on the other hand, which is what we have on the right, shows there's a few additional boosts for the place where our littlest guy is right now. It's providing his specific needs. And that's what's really important. So the CDC, as I mentioned before, has done and does do a lot of work in health equity. And they have many programs that are tailored towards reaching health equity. And so they want to reduce disparities and bring us closer to reaching equity. So they are providing some great boosts. So just some examples, and I have link for you all that I thought was very important in just showing some examples of some health equity programs. One is a program that is done for low-income and Alaska Native individuals. And through adding some patient navigators to this program, they were able to increase colorectal cancer screening rates, and which is huge because there's a disparity that exists there. Also, personalized client counseling has reduced HIV risk behaviors in communities, and this is in programs created for men who have sex with men. And then there's also a curriculum that's been built by the CDC that they use for living well for individuals with disabilities. And this has improved the quality of life in individuals that are in that program. So these are just a few examples of how there has been programming built, how there has been programming built into funding that will help address health disparities and increase health equity. So overall, what can we do in creating disparities? So it's really important to create community conversations in addressing racism and implicit bias. I think that is a huge issue. It's a issue within community programming. It is an issue within our healthcare system, and it is one of the issues that needs to be addressed in order to combat disparities. Those barriers really need to be broken down. On the other hand, instituting this implicit bias training and programming, taking it one step further, is also important because it becomes a required part of a program. You know, when things aren't necessarily required, not all individuals participate, but when it's implemented in a required, with a requirement, it takes more, it takes more, I guess, it takes more root in programming. And then when possible, revising work plans and action plans to include strategies that address environmental changes, not always focusing directly on personal actions within the community, but trying to see what you can change. And this can be an upstream or downstream battle, putting more individuals of influence in the hot seat and working to change policy. One of these policies that is taking a whole lot of effect here in Ohio is that a lot of public housing places are going to smoke free. It's an initiative that's been pushed to reduce the health disparities in asthma in young children. So there is work to be done. So wrapping up, it is extremely important that we look at the entire environment when trying to combat health disparities. We can't do it all, but it is important that we start in the places where we can affect change. We must start with the low-hanging fruit and go up from there. Any piece or part of a program that can be created or implemented or even added or expanded is extremely important. You know, I see a lot of programs that are doing a great deal of vocational support. That's part of the social determinants of health. By putting that program in a community, you provide an avenue for an individual to create or increase their income. This releases one stressor on them, and it creates it reduces one less barrier to having greater health. So these are some sources that I wanted to make readily available for you guys to review because they go a lot more in depth and they provide a lot more actual tools and programming for different individuals to use when combating health disparities. And because you all work across such diverse mediums, I think it's really important for you to be able to go out there and reach and grab what will work for you. So this first is the visual that provides health equity information, which is what I showed you a little bit earlier. And then up under it is a visual and an outline of the programs that are provided. The next one are current equity programs that can be recreated. And then a phenomenal tool that I found is the Gray Bruce Health Equity Tool, which allows you to basically tailor your health equity plan to the work that you do and get more information there. And then I also have a video linked here on preventing bias. I thought it was a great video, and it is from an Ohio-based individual, and it really dives into how implicit bias can affect healthcare and what you can do. It focuses on providers, but I think it can be with community workers and things of that nature to prevent that bias. It's breaking down yet another barrier, and it's yet another thing that will help build health equity in our communities. So while addressing health disparities is not a huge, it's not going to be a huge jump from 1 month to the next, as long as we start to gather that low-hanging fruit and then push for more upstream changes, we will be able to combat these health disparities, and we'll see a reduction throughout the future. So that is all we have for you. Thank you, guys.